Hi, welcome back to our channel Jonaki and Mo Paradise. I hope you know today our having very special session, very popular session, that is Hello Doctor. Every month, usually one eminent doctor we are inviting in our platform to discuss regarding several health topics, right? So also we have invited one eminent personality in our program. But before introducing this personality with you people, first I'm discussing regarding today's topic. Medicinal value of leech therapy. Definitely, after just reading this topic name, you people are thinking, leech, how it could be used? Because it's a deadly creature, like it's sucking the blood from the human being. So how could be applied over the human body? Definitely the people will die. Like that, some tensions also started to creating in your life. So this is a unique concept in Ayurvedic science. In that pre-Vedic period, actually, Acharya Shushruta, he was also very eminent personality. Acharya Dhanvantari, he also actually the guru, or better to say the teacher of Acharya Shushruta. So this Dhanvantari, he also just taught those all other acharyas regarding Ayurveda and their surgical procedures also. So what happened in that pre-Vedic period, they actually observe some very peculiar characteristic of leeches, which is very deadly creature. Like, so what happened? They saw that whenever the leeches started to bite our any parts of the body or any other animals like cows or dogs or anything, because that time also animals were there. So whenever those leeches are biting them, then continuously the blood they can suck, because usually we are knowing that whenever in our body blood is started to oozing out, then within several minutes it's becoming clotted, because inside our blood there is having several factors, okay, which is called as coagulant agent. So coagulative agent usually trying to clot the blood whenever it started to just oozing out from our body. Then what happened? Then it started to clot this blood. Then otherwise what happened? Continuously hemorrhage, profuse bleeding, the people will die. So it is preventing this mechanism. Okay, that's why several factors are there already inside our blood. But that's why they became very much astonished that how it's possible that continuously this creature sucking this blood, because already it should be clotted but it's not becoming clotted, continuously it is oozing and this creature also sucking. So it's just like the vampire like conditions, like so what happened? Then they started to research over this creature, and then they find something is there inside their saliva, which is residing there, some chemical components or some factors which is actually anticoagulant. That's why whenever they are starting to suck, then the blood is not getting clotted, or that's not becoming clotted due to this anticoagulant factor which is presenting over this saliva. So see what's the very interesting factors, and they decided better to use this creature whenever it's required, okay, for any venipuncture or any kind of bleeding, especially the medicinal bleeding or better to say that therapeutical bleeding is required, that time we people can use this kind of creature. And on the basis of this concept, they started to use the leeches, and usually this therapy afterwards became very popular in modern, or better to say the Western countries and other so many Southeast Asia and several countries. Okay, it became very much popular, and usually in Ayurveda this name has been given Jaloka. Jaloka. So whenever they are using this Jaloka or leeches over any body parts of the patient for any therapeutical purpose, then it is called Jaloka Avacharan. In modern science, they have also given some other name, that is leech therapy. Some are also telling herodinal therapy because it's having herodin. It was very brief introduction regarding this leeches therapy, right? Now I am going to start this topic and today's session. Hello doctor. Today entire program will be co-hosting or coordinating by my two students as well as junior doctor, Dr. Tanvi Singh and Dr. Shubhendu Mitra. Both are now intern doctor. And today we have invited very eminent personality, Dr. Shuman Sharkar. He is now the medical officer. Before starting our program, I am requesting my two students as well as junior doctor, Dr. Tanvi and Dr. Shubhendu, please introduce yourself towards the audience.
Namaste, myself Dr. Tanvi Singh, intern doctor at RGNAC, Techno India.
Namaste, myself Dr. Shubhendu Mitra, intern doctor at HALLO District Hospital.
We set some very easy questions regarding this topic because usually the common people, in their mind very common questions are arising. What kind of question may arise? What is their actual queries? Based on that, to make this session very easy to understand, we made all those questionnaires. So based on that, the entire program would be conducted. So I think you people will like it. So please Shubhendu and Tanvi, both people start to conduct the session. Carry on.
Sir, as the today's topic is about Leech, please explain to our viewers that what is this Ayurvedic Leech therapy?
When leech is applied as a therapeutic purpose, you can call as a leech therapy. When it is used as per Ayurvedic Siddhanta, it is known as Ayurvedic leech therapy. As we know, the leech is mainly used in our poetic condition. So in the poetic disease, the leech is generally used.
Sir, from which country this leech application first invented?
Leech therapy is a very ancient technique. In India, it is used in various medicinal purposes. In our old Samhita, its use has been mentioned. In Susu Samhita, there are separate chapters about the leech. Though in ancient Greece, Egypt, the leech therapy is also mentioned. In the 18th century, it is also familiar in the European countries. The first medicinal leech farm is grown up in Wales, as known as Bar Farm at 1981. The US Drug Administration also gave green signal for application in leech in America also.
Sir, many times the question is arising that why and how is the leech being used in medical field nowadays?
Leech is a painless procedure. There are various substances found in the leech saliva which help in prompt healing, like as anticoagulant, vasodilator, anti-inflammatory. It also has anesthetic-like substance which makes the procedure painless. In leech saliva, there is hirudin, kaolin, etc. are the anticoagulant, whereas the hyaluronate acetylcholine is the vasodilators. It also has the anti-inflammatory properties as bedlin, ilgins, isotretinoin, etc. So due to all these substances, leech have extensive medicinal value in the medical field.
Okay, sir. Why should people go for leech therapy?
Leech therapy is a safe procedure and it is painless. So everyone can go for the leech therapy, but we first educate the patients about the leech so that they should not fear about the leech.
Sir, you told many things about this leech therapy. Sir, please kindly explain that what is the method of this leech application?
So how can we apply the leech? So before application of the leech, we should prepare the leech. Leech should be washed with the Haridra water, then it should be kept in the fresh water. We also prepare the site. For preparation at the site of the leech application, we can give some shading on that area so that circulation increase on that site. Then wait for some time. After that, we should apply the leech on that proper area. If leech cannot suck the blood, we can make a micro puncture so that leech can initiate sucking. Thereafter, we should cover the leech with wet cotton so leech cannot hesitate in that uncomfortable surrounding. Then wait for some times, near about 30 to 45 minutes. If leech should not falling down, then we can apply the Haridra near the mouth of the leech. Then it should be fall down, and thereafter we should go for the vomiting of the leech by Haridra Chunno. And also we apply the Haridra Chunno at the site of the leech bite. Then we can elevate that part and wait for some time. Thereafter, half an hour after monitoring the patient, we can bandage that area and patient is now ready to live.
Sir, in what kind of disease is leech therapy applicable?
Leech is mainly used in poetic condition. It is mainly used in skin disease, though it has a great role in wound healing also. Jologa is also used in musculoskeletal disorders. It is generally applied at the trigger point where pain is much more. In the modern science also, the leech is applied for reconstructive surgery or plastic surgery for prompt healing and at the site of reconstructive surgery.
So many times we are getting the question that how much blood can a leech suck?
Leech can suck 5 to 10 ml of blood. One research suggests that leech can suck blood more than 10 times of its own weight.
Sir, during therapy at starting, while leech bite to people, can feel pain or any sensation?
It is a painless procedure, so people can find nothing. Though he has sensation of some cold feelings at the site of leech application.
Well, sir, is there any chance of complications like hemorrhage during this leech therapy?
Generally, it is very less complicated procedure. Though some bleeding can occur in coagulopathic disorder patients, on those cases, we should apply hydrogen at the site and apply bandage and then monitor the patient for 3 to 4 hours. And also we should elevate the part of the bite injury.
Sir, does anemic patient applicable for leech therapy?
Mild anemic patient can also go for leech therapy. Generally, above hemoglobin above 7, there is no problem with leech therapy.
So how about this cardiac patient taking the leech therapy? So can they take leech therapy?
Cardiac patient can also go for leech therapy. Though leech therapy has some good result in myocarditis, endocarditis also.
Sir, can high blood pressure patient take leech therapy?
Hypertensive patient can also go for the leech therapy, but we should stop anticoagulant drug before the leech applications for 1 to 2 days.
And so the most important question is that how much sitting is required for this leech therapy?
There is no such demarcation how much sitting is needed for leech therapy. As per condition, we go for the leech therapy, setting of the leech therapy. In acute condition, we go for leech therapy. Thereafter, we can go for the conventional treatment.
Sir, what kind of patient should not take leech therapy?
Mainly the coagulopathy patients and arterial disorder or immunosuppressive patients who are more prone to infection should not go for the leech therapy.
So I think audience also thinking that if continuously this bleeding is occurring, then definitely patient will die due to the continuous hemorrhage or due to the anemic conditions, right? No. Actually what happened? It has been seen yet that jaluk or the leeches, they are actually sucking most of the cases impurified blood. Whenever they are started to suck, then only the impurified blood they are sucking very nicely. So maximum 10 to 20 ml blood they may suck at a time, because usually what you know, if you are going to see their actual shape and size, whenever they are sucking, afterwards they becoming larger, 4 times larger their original body shape. Okay, so whenever they are becoming that much larger, and when they sucked maximum 20 ml bloods, then they automatic fall off. Okay, but it also has been seen it whenever they are started to suck some purified blood, then usually the person or the patient also complaining that I'm feeling little bit itching or burning sensation. That time usually we are also getting very much conscious about the factors that might be the leech start to drink some or suck some purified blood. Then and there we are just withdrawing and we are just removing this leech on that site. Okay, so that is the factor. So what happened? 20 ml blood. You see, sometimes whenever we are donating the blood, usually in the blood camp and all, to 50 ml. So comparison that only 20 ml blood, what would be? No, there's no dangerous, there's no way to become fallen sick or any hemorrhage. And another thing, as proper, if you are going to do this leech therapy by proper Ayurvedic physician, then definitely the physician first will send you for blood check, your hemoglobin rate, your TCD/CSR, along with your CTBT, I mean clotting time, bleeding time, they will check. After seeing the report, Then only, not only that, sometimes if it is required, then we are sending the people for any ELISA test and all. Okay, there is having any hepatitis B or what, any AIDS or what. Regarding that, several tests, if it's required, we are sending. Okay, so what happened after testing? We are going for this leech therapy. So don't think that haphazardly we are doing and there would be any complication like anemic conditions or any hemorrhagic conditions will develop. Okay, there's no chance. Using in different health conditions, especially for pimples, it's having so many cosmetic values for pimples, or acne, and so actually what happened, it's also sucking all the pus or the blood which is very impurified and stagnated over that pimples or acne areas. Okay, so this sucking all those impurified blood along with the toxic materials too. Not only that, even sometimes any deep vein thrombotic conditions or DVT patients, there's also we are using whenever the blood is getting stuck there or totally stagnated, there also it's using. Not only that, even in case of the varicose vein, there's also it's working very nicely. Besides that, any kind of skin diseases, eczema, sometimes psoriasis, where actually the polluted blood or vitiated blood is residing there, it's entirely sucking those impurified blood. Even sometimes, some people are having non-healing ulcer. Several years over, but the ulcers or the abscess like something is there which is not getting healed up. So in that cases, especially for the non-healing ulcer, it's working very nicely. So that's a very brief, I think, introduction regarding this leech. And the last question, I think you people will think of, so that leeches also, there is having some variation. Some leeches are poisonous, some leeches are non-poisonous. So all kind of leeches could be applied over the body parts? No. That's true that there is having two types of leeches. First one is very poisonous. Usually they are residing in very dirty, polluted areas. Okay, and usually the non-poisonous leeches, they are residing in very clear or comparatively clean ponds or lakes, okay, like that areas. So what happened, so that is the thing, that the expert person, whenever they are selecting and collecting, usually they are collecting the non-poisonous leeches from this clean, comparatively clean ponds and lakes. Okay, and another thing also might be you are thinking that what happened after these leeches when they are sucking this blood, then actually what we are doing, then after just draining out the vomitives, then again this leech is becoming active, and some procedures are there. We are also putting some agents like haridra and all to make them energized again, and again we are keeping inside one bottle and we are making close. And usually the bottle cover, this cover is having several holes. We are making these holes, through that the oxygen is usually passing through that, so they can respirate properly, this leeches and all. So always keep in mind that for one patient, if I have selected 2 or 3 leeches I have to apply, then usually a good doctor, okay, not quack, the good Ayurvedic doctor usually using for one patient their individual leeches. They never ever using the same leeches for other person. This leeches for that person. So whenever we are using, then first the bottle we are writing the name of the patient, their age and how many leeches using, and same leeches we are putting there after completing this therapy and we are keeping one side. Never ever we using this same leeches to other patient, because might be there is having any chance to contaminate any skin diseases. Same leeches we never ever using. Okay, thank you so much, sir, for your very lucid and informative session. And we today also we came to know various information regarding leeches and their therapies and their medicinal properties, why we should use the leeches in case of some surgical cases, Ayurvedic surgical cases. And definitely I am giving a special thanks to Tanvi and Shubhendu for their very nice coordination of this entire session. And for you people also, for the audience also, I'm having such a message that I think you people also liked our program. In future also we will come along with some other eminent person along with some interesting topic to health related topic, which definitely you people will like. And from my side, one request is there that please subscribe, don't forget it, because your subscription is our motivation to create more new topics, new videos and all. So now the time came to say bye bye.
Thank you, ma'am. Thank you, sir, for the wonderful sessions. Thank you, ma'am, for arranging this kind of sessions. Please keep on arranging these kind of sessions. And sir, thank you very much for explaining this leech therapy completely to us, to our viewers, and it is really very important for us. Thank you, ma'am. Thank you, sir, for the very informative session.
Thank you, sir. Thank you, ma'am, for this wonderful session. We have learned so many things. Thank you.